pretty exciting lately that we have a bunch of options now for how to treat COPD, as opposed to several years ago when all we could use really was inhaled bronchodilators, sometimes with the addition of anti-inflammatory inhaled steroids. People with upper lobe predominant emphysema who have low exercise capacity, we can offer them lung volume reduction surgery, which turns out to be the only therapy other than oxygen which improves COPD mortality and is an important therapy to offer in specific populations.
Lung volume reduction surgery for COPD is a well-studied entity. There was a large study performed at the end of the 1990s going to the 2000s called the NET trial, National Emphysema Treatment Trial, and that defined very well both the natural history of the disease process and also identified patients that were likely to benefit from this surgery. We know that patients achieving these, again with the appearance of their emphysema on chest X-ray and CT scan, which is primarily located in the top parts of the lungs, are most likely to feel better, walk farther, and have a better quality of life if they satisfy these criteria and go through lung volume reduction.
Lung volume reduction surgery should only be considered after conventional therapies have already been expended. Those should include smoking cessation, the use of pharmacologic therapy, supplemental oxygen for patients who are hypoxemic, and the use of pulmonary rehabilitation. For patients who still experience significant impairment in functional status and quality of life despite those interventions, that's when we consider lung volume reduction surgery. The ideal candidate for lung volume reduction surgery is highly motivated, has an FEV1 in the range of 20 to 45% of predicted, is markedly hyperinflated, and importantly has upper lobe predominant emphysema. That patient should also lack significant complications of their COPD, including excessive oxygen requirements, marked hypercapnia, and pulmonary hypertension. And notably, they should also be good surgical candidates lacking significant end organ damage such as coronary artery disease.
LVRS, lung volume reduction surgery, is underutilized in the United States. It's very rarely offered to COPD patients, yet it can be very beneficial in carefully selected people. So it's important to assess those people with CT scan and offer the therapy in those who are appropriate for the surgery.
Patients who undergo lung volume reduction surgery or are contemplating it should be aware of three significant limitations. One is there is a perioperative mortality rate in the range of 3 to 5%. Second, the benefits of lung volume reduction surgery are not guaranteed, and only approximately 50% or less of even the ideally selected patients will derive benefit. And third, for those who do derive benefit, those benefits typically wane by 5 years after surgery.